Happy to be here to present an update from HRI, Homewood Research Institute, where I'm the Director of Research and Evaluation, and have the pleasure of working with James, the DeGroote Centre for Medicinal Cannabis, also Peterborough Centre for Addiction Research as well. So today I'd really like to highlight some of our collaborative activities that are currently underway and give you a little snapshot of where we plan to be going in the next 5 years as a research institute, and particularly highlight some of the activities we've been doing around cannabis research. But before I get started, I'd just like to acknowledge that HRI is located on the traditional lands of the Anishinaabe, Adenawandron, Haudenosaunee, and Métis peoples, and the treaty lands of the Mississaugas of the Credit. So as some of you may know, HRI is an independent, non-for-profit charitable organization, and we're located in this beautiful building located on the grounds of Homewood Health Centre in Guelph. And as a research institute, we are guided by the vision that no life should be held back or cut short by mental illness or substance use issues. And we work with a number of existing and emerging partners, including Homewood Health, who is our primary practice partner, as well as various other academic institutions, world-renowned scientists, and national organizations. And together we work to improve mental health and substance use health services in Canada and around the world by doing applied research and driving innovative practices through the rapid translation of knowledge into practice. So we can be sure that people receive the highest quality care possible when it comes to mental health and substance use health. So earlier this year, we launched our new strategic plan, which identifies 5 strategic goals that will guide our work over the next 5 years and help us ensure that what we do leads to its intended impact. That is to ultimately drive changes and improvements in care with respect to mental health and substance use health. I'm not going to speak to each of these goals directly, but numbers 1, 2, and 4 are particularly relevant for today's update and discussion. So our research priorities to date reflect 2 very established programs of research. One focused on substance use health, led by my colleague, Dr. McKillop. Another focused on trauma, led by my colleague, Dr. Margaret McKinnon, as well as 2 emerging programs of research, one in depression and the other in concurrent or co-occurring conditions, which may be any combination of the 3. Broadly, these research objectives across these 4 programs are similar in that each aim to characterize the clinical populations or the people that come for treatment, measure the changes in treatment outcomes, identify modifiable or potentially modifiable treatment markers, identify and develop and test measurement-based care tools and processes. Next, utilize and evaluate digital innovations for the assessment of and for treatment itself. And finally, to evaluate the impact of novel treatment approaches and or natural experiments within this population. And I'll speak a bit more about that in a minute. But importantly, at the foundation of what we do is the notion of a learning health system, where knowledge is generated from our research and integrated with other internal data and information. And together, this knowledge is to put into practice. And that's not only at Homewood, but the intent is also across other treatment settings and across the system at large. So at the heart of our research programs is really a standardized clinical data system. And in this case, implemented across Homewood Health Services. And this data system really supports patient-centered care. It supports measurement-based care practices. It also supports quality improvement, program evaluation, and research purposes. So the same stream of data will allow us to address all 3 of these objectives. And these data include brief validated measures, including those related to substance use disorder symptoms, depression, anxiety, PTSD, along with various other clinical indicators that might be related, including readiness to quit, confidence, therapeutic alliance, and others. But these are collected upon from every individual entering treatment, upon admission, at a midpoint or a progress assessment, at discharge, and then post-discharge. Access to these data really has enabled research activities that, as I've mentioned, allowed us to characterize the clinical populations, and particularly the diversity of clinical indicators that and conditions that people come into treatment with, and then identify some novel treatment targets or areas that we may want to intervene. It's also allowed us to understand changes within and post treatment, which has been very valuable, and evaluate natural experiments as they may occur within this treatment setting, or in the case of cannabis legalization, be occurring outside of the treatment setting, but may have impact on this population. And sorry, there we go. And that leads me to the cannabis-related research, three of which I'll highlight 3 activities today. First, we were fortunate to receive some funding from CCSA through the Closing the Gaps initiative to investigate trends in cannabis use and symptom severity among treatment-seeking population, particularly those with substance use disorders. And although we found initially no changes in these trends pre and post legalization, we recently updated the analysis with additional time points, which allowed us to look kind of further along in that trajectory. And we are beginning to see some slight increases in symptom severity and slight decreases in readiness to quit among this treatment-seeking population, particularly after legalization had become more commercialized and with the proliferation of store frontages. And my colleague, Emily Britton, will be telling you a bit more about that this afternoon, so please stay tuned. Second, with the same funding, actually, we were able to examine the associations between cannabis use and some psychiatric comorbidities among the same clinical sample, and identified some discrete profiles of individuals who had varying degrees of cannabis use disorder, as well as varying degrees of psychiatric symptoms, ranging from low CUD and low psychiatric symptoms to quite high CUD and psychiatric symptom severity, really highlighting the diversity in the client population and the need possibly for different pathways of treatment in this case. And finally, we investigated recently, my colleague Dr. Marie Gundy, I think is in the audience as well, we investigated cannabis use disorder and other psychiatric conditions among a subset of individuals who had been using cannabis for medicinal purposes, or in some case dual purposes, including recreational purposes, and found that many of these individuals also met criteria for cannabis use disorder, and particularly those with concurrent disorders. So together, these findings give us a bit of a snapshot of what might be happening within a clinical population, particularly those who may already be using cannabis at high rates and may also be suffering with other concurrent conditions. And finally, just to highlight, one of the ways that we are beginning to share our research and its findings is through a series of webinars titled HRI Talks. And through these HRI Talks, we present new ideas, discoveries, and studies that are helping to transform mental health and substance use health landscape in Canada and beyond. And our most recent one was a reflection on the 5 years of legal cannabis, including Dr. McKillop, Dr. Alexander Cottarella from CCSA, and Michael DeVilliers. And together they shed light on how the changes in cannabis legalization status has really affected the landscape of mental health and substance use health research and treatment in Canada. And if you didn't get a chance to join us on September 14th, I encourage you to visit our website and watch the recording, which you can find under our news and events heading. And with that, I'll turn it over to the next speaker. Thank you.
Thank you so much. Our last stakeholder update will be from Dr. Brad Connor from the Research Society on Marijuana.